Assalamu alaikum. I am Dr. Farjana Khanam, Assistant Professor of Anatomy Department. Today I will give a video on the pectoral region. Now it is a part of superior extremity in which we know pectoral region lies in front of the chest. In pectoral region we have found some muscle, some mammary. One of the important structure in our body is mammary gland, then fat and some bony structure and also some fascia. Then now comes to our pectoral region. After dissecting the incision of the skin, we will found the superficial fascia. Superficial fascia will contain is the fat and the mammary gland. In superficial fascia is overlies above the pectoralis major muscle, and the content of the superficial fascia is the lateral and cutaneous nerve, lateral and anterior cutaneous artery, platysma muscle and breast and the mammary gland. Now comes to our cutaneous innervation of the pectoral region. The skin of the pectoral region is supplied by the branches of anterior, medial, intermediate and lateral supraclavicular nerve and the ventral rami of the intercostal nerve. The supraclavicular region usually supplied above the clavicle, and the ventral rami of intercostal nerve usually supply the second to sixth rib, and the superficial intercostal arteries which are supplied the cutaneous branch. The cutaneous branches of the arteries are passing through the or accompanying with the cutaneous nerve. The branches come from the perforating branch of internal thoracic artery. Then we again repeat the cutaneous nerve supply and cutaneous artery supply of the pectoral region. The skin of the pectoral region after the incision will found the superficial fascia. In superficial fascia, one of the content is cutaneous nerve. The cutaneous nerve comes from the cervical plexus and intercostal nerve. The cervical plexus is one of the branch is supraclavicular nerve. From the supraclavicular nerve are three types: medial, intermediate and lateral. From these three branches, the supply the region of the pectoral region above the clavicle and just below the clavicle. This region is supplied by the branches of the supraclavicular nerve. Then comes to the ventral rami of intercostal nerve. It comes from second to sixth intercostal nerve. This region supply along the second to sixth ribs. Now comes to our artery. The cutaneous artery are the branches of perforating branch of internal thoracic artery. আমি আবারও বলছি, cutaneous artery are the branches of the perforating internal cutaneous artery. They accompany along the cutaneous nerve. Then third component is the platysma. Platysma is the subcutaneous muscle. It arises from the pectoral fascia and then inserted into the base of the mandible along with the skin. This fascia protect the external jugular vein and this muscle is supplied by the facial nerve. তাহলে আমরা যে মাসলটি কথা বললাম সেই মাসলটি হচ্ছে একটি সাবকিউটেনিয়াস মাসল. This is called platysma. Platysma arises from the pectoral muscle of the fascia, then it comes along the clavicle, passes along the clavicle, crosses the clavicle and lateral side of the neck, then it inserted along the base of the mandible, then along with the neck. Now this muscle is supplied by the facial nerve. Now comes to the mammary gland. It is important gland in our body. It is called glandular structure, mammary gland, which lies in the pectoral region. And also the pectoral region, it contains the fat which is continuous with the muscle. Now what are the muscles present in the pectoral region? This is very important for us, and the muscles are pectoralis major, pectoralis minor, subclavius, and one of the muscle is serratus anterior, which is also included in this region. So there are four muscles we have included in the pectoral region, that is pectoralis major, pectoralis minor, subclavius and serratus anterior. In these topics we will discuss here the origin, insertion, nerve supply and action of this muscle of this region and some clinical importance. Now first one is the pectoralis major muscle. Origin, it has a clavicular head and sternocostal head. Clavicular head from the front of the medial third of the clavicle, sternocostal head from the anterior aspect of the sternum and upper 6 costal cartilage. So this is the origin. Insertion ki hobe? Lateral lip of the intertubercular sulcus or bicipital groove of the humerus. Again, this is very important in body dissection and viva, and also sometimes in written. In written, there is a question that write the origin, insertion, nerve supply in a tabulated form, then gives the muscle name. So, insertion, lateral lip of the bicipital groove of the humerus. It is very important to know the mode of insertion in bicipital groove. Pectoralis major is inserted into the bicipital groove by two lamina, anterior lamina, posterior lamina. Anterior lamina is short, posterior lamina is long. Anterior lamina is inserted into the lower part and posterior lamina is inserted into the upper part. Now, what is the action of pectoralis muscle? It is the adduction and medial rotation of the arm, that means shoulder joint, flexion of the arm, that is clavicular portion. Nerve supply, lateral pectoral nerve, medial pectoral nerve. We also know the root value of lateral pectoral nerve, cervical 5, 6, 7 and medial pectoral nerve is cervical 8 and thoracic 1. Here is a picture, we see that this is the dissection of the body showing the pectoralis major muscle. Now comes to the pectoralis minor muscle. It originates from the 3rd, 4th and 5th ribs near their cartilage, that means costochondral junction. Insertion, medial aspect of the coracoid process of the scapula. তাহলে আমরা আবারও বলতেছি medial aspect of the coracoid process of the scapula. Then action, depress the point of the shoulder. If the scapula is fixed, elevated the ribs of the origin and helps in force inspiration. Nerve supply, medial pectoral nerve, that is cervical 8 and thoracic 1. This is the picture that shows the pectoralis minor muscle in the body. Now comes to our third muscle, that is subclavius muscle. It originates from the first costal cartilage or costochondral junction, then insertion in the lower surface of the clavicle, that is in the subclavius groove. In this picture we see the subclavius groove and the red color is the origin and insertion of the muscle. And what is the action of subclavius muscle? It is very important. Depress the clavicle and steadies the bone during movement of the shoulder girdle. Nerve supply from the root of the brachial plexus, that is nerve to the subclavius, and the root value is cervical 5 and 6. Now, the one of the important muscle in our body is the serratus anterior. It originates from the outer surface of 8 ribs, that means it has a 8 digit of number. Insertion, this is very important. It inserted into the medial border of the in an inferior angle of the scapula. In insertion, the mode of insertion from the superior border up to the spine of the scapula, first one is inserted, then second and third digitation is inserted along the medial border, and last 5 fleshy fiber are inserted into the inferior angle. This is very important. It is usually asked in viva in Prof. What is the action of the serratus anterior? Draws the scapula forward along the thoracic wall, rotate the scapula and steadies the scapula and helps in force inspiration. তাহলে আমি serratus anterior চারটা ফাংশন বললাম. Number 1, draw the scapula forward along the thoracic wall. Number 2, rotation of the scapula. Number 3, helps in abduction of the arm. Number 4, helps in force inspiration. And nerve supply, nerve to the serratus anterior or long thoracic nerve, and the root value is cervical 5, 6, 7. In these topics, one of the important clinical one is that is winging of the scapula, why this occur and how this occur. If any nerve injury like long thoracic nerve is injured in this course, the serratus anterior will be paralyzed. So, the muscle cannot steady and forward rotation of the scapula. As a result, the winging of the scapula is occur. In winging of the scapula, medial border is unduly prominent. Medial border and inferior angle is unduly prominent. That means the person cannot do any pushing structure. This is very important for our written. So, this is all about our pectoral region. Thank you very much.